My point being is, I've been on this squad for 20 years. I've been to a lot of calls for choking, but I've never actually seen anybody ever choke. Because, as we all know, because we've all done it before, it happens so quickly. And you either get it out or something happens. Now, if it's so severe, as you were asking, what do we do next? They're going to lie down, and you're going to do those compressions. You're going to keep doing those 30 compressions. After you do that, you're going to open up the mouth with your thumb. With your other hand, you would scoop it out. I'll show you right here. But I'll bring this up because I want everybody to see. So we would do our 30 compressions, shoulders over the wrist. After that, we're going to take our thumb, the hand that was right here, the hand that should be at the head. We're going to look. If we see it, then we scoop it out. Only if we see it. And then we would go right back to our compressions. If this was the community course, we'd actually give the breaths, but we're not learning how to give the breaths today. Okay? That being said, you want to keep priming that engine, that heart. Because if they stop breathing, their heart's going to stop very quickly. Okay? Does anybody have any questions on this so far?
Alex?
Yes, sir.
What counsel would you give to somebody who, when confronted with this incident, is in the moment and panics about how to administer this treatment? I mean, it's great for us to do it as a demo, and we're here in a classroom and stuff, but you know, with a family running around screaming and people panicking, what counsel would you give?
The first thing you would do is you would come and take one of my classes. And I'm not trying to be funny about that, because we go in depth. The other thing I would do, after you take the class, you're going to get a book. And when you get that book, I'm going to have you put it in the best place that you can that you'll only be alone, the bathroom. And I want you to, every so often, read the book. Because the problem is, 90% of what you're going to learn, you're going to forget 3 weeks after I teach it to you. Not because you're a bad student, it's not because I'm a bad teacher. It's not in your world. The only way you get better is by practice. Now, you guys are in the sprinkler business, correct?
Yes.
The fire departments have basically fire prevented themselves out of the business. Is that almost fair to say? That's what they think, but it's because of your products. We're doing a great job. And because of that, people get complacent, and that's why there's fires, like in Berkeley Heights recently, that happened to be my brother's office. Doctor's office, it's gone. Because unfortunately, something happened, electrical malfailure, and everything went. So they're still doing it. And it's because you have to keep practicing. You have to keep practicing, and you have to keep on top of things. I tell this to people. I'm in the preparedness business, and you know where I was the day after Sandy? I was at Costco, just like everybody else, because I forgot batteries. And I know you shouldn't say that, but it's true. These things happen. We had enough food, but we just didn't have the batteries for the lights. So back to your point, you need to make it part of your life. For instance, if something happens to the family, you should have a rallying point if there's something that happens at the house. It's all those things that you teach your kids when when they're little. It gets more important as they get big. I think the saying is, as your kids get older, the gifts get smaller but more expensive. Well, it's the same type of thing. You want to make sure that everybody is on the same page. Does that make sense?
Mm-hmm.
Okay. Does anybody else have any other questions? Yes, sir.
How do you distinguish when the CPR or AED is required? I mean, some people can pass out for multiple reasons.
Absolutely. And that's why you're going to wait. And that goes back to your point, I think, as well. You're going to shake and shout. If they don't respond, there's something wrong, then you're assuming that they need CPR. Okay? Now we're going to talk about the, yes, sir.
If they're in bed, do you move them on the floor?
That's the best question of all, Chris, because the fact is you do. You have to get them on the floor for one reason and one reason only. There's springs.
Right.
Unless it's a hospital bed and they have a CPR button where they can flatten it out. Other than that, you have to put them on the floor. And it goes back to scene safety. If they're on the stairs, if they're in a piece of equipment, I know you're a big CrossFit person. I know they have you doing all sorts of wonderful things. But you could be in a position where, God forbid something happens, you got to get all that equipment away from you. It could be in your office equipment. I mean, I know even in these chairs, somebody could slump over. You got to get a table out and everything else. And it really gives you a different perspective on how you approach different things. Now, I'm going to talk about the AED. And this particular brand is the Cardiac Science AED. And the reason why I'm with Cardiac Science is I really feel it's the best AED out there. It has several features that I've seen no other AED do. That's this type of line. When you're in the hospital and you have a heart attack and they use the defibrillator on you, they use what's called a graduated charge. They start at 100, maybe 150, and move their way up as they charge. Is that correct? Okay. The paramedics do the same. But 99% of all the other AEDs out there don't do that. They give one charge, that's it. Meaning if they are going to give a charge, they're going to give 150 or 300. The problem is the charge that you're going to need, I guarantee you, is going to be a lot less than the charge that he needs. Okay? So, Cardiac Science has developed a AED that has that graduating charge, which helps because there was a case of a gentleman in South Jersey, very large person, over 400 pounds. They put 2 AEDs on him because they knew they each had 150. They brought him back to life, which is amazing. That's great that they did that, but who has 2 AEDs lying around? This also has a 7-year warranty. Now, for those of you that do know about AEDs and have seen them in the schools and everything else, usually 5 to 7 years it needs to be replaced. Not the pads, not the batteries, the whole entire AED. And the reason being is it's out of manufacturer's warranty. And you know as well as I, if something breaks and it's out of manufacturer's warranty, what's the manufacturer going to say? Not my problem. That's why you need to not only replace the pads and the batteries, you need to replace that unit on a regular basis, on a 5 to 7 year. This has a 7-year warranty. Okay? We also do a service program where we can actually change the batteries and change the pads. And I've told a couple people this story, but this is the most shocking thing in the world. Back in the 80s and early 90s, the AED companies gave AEDs to all the airports, right? It was the most wonderful thing they could have done. And 3 years after, none of them worked because nobody had pads that were working and all the batteries were dead because nobody bothered to check them. So to prevent that, that's why we have service plans. And that's why you go out and you constantly do that. So this is actually a live AED. So what I want to do is I want to show you exactly what it can do. This is actually an automatic AED, which is really a strange thing for someone like me in the medical field because it's a brand new thing. But the reason why they started using an automatic AED is because 70% of the people refused to press the button. And it wasn't just the lay people, it was the medical community. Oh my God, I actually have to press the button? Not to mention, they just wouldn't do it. The hardest thing about an AED is to learn how to turn it on. Now this is a trainer, and I just want to show you the difference in terms of the way to turn it on. Press the button, turn it on. This one, press the door, turn it on, okay? My old football coach used to tell us you have 2 ears and 1 mouth, and you should use them in that ratio. Now, we were undefeated, so we did a lot of that. But the fact is, if you do that, you will save someone's life, or you'll get the opportunity to save that person's life. Now, what's going to happen is, I'm going to try to take this out. There we go. You put it right next to their head, but don't touch their head. Now, I have this nice little nifty-difty gadget right here, which we can actually use this without it actually charging or whatever else. Now, your next question would probably be, well, what if I put this on somebody that doesn't need it? Like if I put it on any one of you right now, what would happen? I was going to say check breathing, check patient, because hopefully all of you are fine. Because it's only looking for one type of rhythm. And it doesn't really matter the type of rhythm. I know you could probably tell me all the different rhythms that are out there because you're in the healthcare field. But all I care about is one, a shockable rhythm. There's 2 types, a shockable and a non-shockable rhythm. And that's what we're looking for. But not only is the AED there, there's a ready kit. And that comes with all the AEDs that we sell. And in that, there's a razor, there's a scissor, there's a towel, and a mask. Now, you take the scissor, you cut straight down. I don't care, girl or boy, Good bra or not, it all goes. The reason we do that is we need a clear field. Okay? Now, if they're in water, we take them out of that water. We don't want any pooling around there. Because last time I checked, electricity and water like to mix. So we make sure that it's as dry as it can be. But yes, you can do it in the snow. After that, if they have a hairy chest, you shave that area from the clavicle to the nipple. 1, 2, 3, boom, done. The other one is going to go from right here. Usually people don't have hair right here, but if they do, you just shave it real quick.